Excellencies, ladies and gentlemen, dear friends, the NCD crisis is a silent crisis that has been going on for more than a decade. Worldwide, 41 million people die every year due to the slow silent killers: respiratory diseases, cancer, cardiovascular disease, diabetes, mental illness, and other non-communicable diseases. More than 800,000 people commit suicide. The death numbers are rising year by year. Also, younger people are dying. NCDs cause more than 50 million premature deaths annually. A large majority of these premature deaths occur in low and middle income countries, as much as 86% actually. And now, people who are living with NCDs die from COVID-19 because people living with NCDs have increased risk of becoming severely ill or die from COVID-19. In Italy, 68% of the people who died from COVID-19 had high blood pressure, and 31% had diabetes. The WHO calls this comorbidity between NCDs and COVID-19 a deadly interplay. One explanation is the long-time global underinvestment in NCDs prevention and control. Today we will talk about how we can tackle this dual crisis: NCDs and COVID-19. From WHO's assessments of impacts of the COVID-19 response, we see that NCD prevention and treatment have been disrupted in many countries. Fewer cases of NCDs are discovered because of the lockdowns. People living with NCDs do not get the treatment their survival depends on. Essential rehabilitation services after heart surgery and strokes are disrupted. Therefore, countries need to include prevention, detection, treatment and rehabilitation of NCDs in their COVID-19 response plans. We will also talk about how we can build back better. The past months we have experienced what governments, health personnel and people all over the world can do when facing a health crisis. It has been extraordinary, overwhelming and absolutely impressive. We need to use this spirit, this strong will of people and governments of winning the battle, of ensuring the survival of neighbors and fellow global citizens, because premature deaths from NCDs are avoidable, the same way as COVID-19 deaths are avoidable. We know how to prevent them. This would also have economic benefits, since NCDs have huge economic consequences for the individuals and their family. I am so pleased to co-host this event together with the World Health Organization and the NCD Alliance. They were also important partners when we launched the Norwegian NCD strategy in November last year: Better Health, Better Lives, Combating NCDs in the context of Norwegian development policy. WHO is our main partner in the following up of the strategy. NCD Alliance is also an important partner, since the efforts of civil society are invaluable if we are to win the NCD battle. Norway was the first donor country with a strategy focusing on NCD action in developing countries. I hope other donor countries will follow our example. There is a huge need for funding. Despite the enormous death burden in low and middle income countries, NCD's efforts only receive between 1% and 2% of all global health-related development aid. We have started working on the implementation of the strategy. The work was put on hold because of the COVID-19 pandemic. Now we see that the action points that were included in the strategy are important also in the battle against COVID-19. We need to strengthen health systems in low-income countries. We need to prevent and reduce risk through multisectoral measures. And we need to increase the access to health data and health information. The WHO has found that both smoking and air pollution, two of the main NCD risk factors, are also important COVID-19 risk factors. People who smoke and people exposed to high levels of air pollution have high risk of dying from COVID-19. This shows that the action points in our NCD strategy will be an important part of the Build Back Better strategy, and they will be important in order to fulfill the Sustainable Development Goals. Improving the health of the world's poor is not only a main goal in itself, it is also a major pathway to eradicating poverty. The time for action is now, because in only 10 years we are supposed to have reached all the SDGs. I wish us all good luck with the battle against NCDs and COVID-19. Thank you.